Hello and welcome to tonight's Google Hangout session with Paging Dr. Ram with CSU Equine Field Service. We are happy you are here with us. We've got 3 presentations that we'll briefly go over a few topics related to equine skin disorders, especially those related to summertime conditions. And then we'll go through a quick question and answer session. And as we go through these talks, you can submit questions by just commenting below, or you can use hashtag #PagingDrRam, and that will also on any of the social media programs, and then that will also link to our program, and we'll try to answer as many as we can. Otherwise, we'll email you tomorrow with responses. All right, so to get us started, I am Dr. Elsbeth Swain, and I am part of the faculty for Equine Field Service at CSU. And I'm joined tonight with Dr. Mindy Smith and Dr. Luke Bass. Can I have both of you introduce yourselves and just talk a little bit about yourself? Dr. Smith, let's start with you, and then we'll go to Dr. Bass.
Hi, I'm Mindy Smith. I am here to talk to you tonight about fly bites. And I've been here for a few weeks, starting my internship with CSU. I'm really excited to be here.
Awesome. Thanks, gang. Dr. Luke Bass here. Joined the team 3 years ago. Very happy to be a part of another Google Hangout. Talking about summer skin disorders. My portion will be the ever frustrating sarcoids. So really excited about this tonight as it really pertains to the time of year, and we're hoping you can gain something from it.
Okay, thank you both. All right, I'm going to get us started tonight. I'm going to switch over the screen to the PowerPoint presentation. Get us started. Okay. Again, my name is Elsbeth Swain. So we're going to start off with sun-related injury, and beginning with sunburns. So just a reminder that UV rays from the sun can be damaging to the skin. This is especially important as we think of Colorado, because we are at a higher risk for UV ray injury at higher elevations. And just a reminder as when those rays are most dangerous or strongest, and that is in the middle of the day, 10 a.m. to 4 p.m. is generally when those have the most potential for injury. The most at-risk horses are those that have non-pigmented skin, or even those that have pigmented skin in some areas and non-pigmented skin in other areas. Common breeds for this would be Appaloosas, paint or pinto horses, Cremellos even can have very pale skin. And the reason for this is that the melanin that makes the pigment in the skin helps to block the damaging UV rays and helps prevent the pigmented areas to have sunburn. And so it's mostly those non-pigmented areas that are affected. Signs of sunburn include some horses that just all of a sudden become head shy, and this is related to just the pain of halters or bridles around their face as their skin gets irritated and is responding to the burn. Other visible signs can be increased redness around the non-pigmented areas or the white or pink areas, and roughened looking skin or scaling skin, skin loss even, and of course pain, just like it would be for us as humans. Some of the treatments are very similar to what we would do for ourselves. Thyme, of course, can help heal sunburns, and then soothing creams can be applied. Most of them you should discuss with your veterinarian before applying, just to make sure that they don't have anything that would be continue to be irritating to the horse and actually cause more harm. And you also want to make sure you avoid the eye itself. Some burns can happen around the eye, and you never want a cream to drip into the eye and cause harm. One cream that we like using is a prescription cream, but it's something that they use in humans for burns and can be very soothing to horses. And then, of course, one of the big things is to reduce the UV exposure for that horse. Repeated UV ray injury can cause other problems, and so just like in people, this can over time and in some horses cause skin cancer, and there's various types of skin cancer that can be problematic. The UV rays themselves can damage the DNA in the skin cells and cause them to mutate. And so one of the things that we worry about in horses, especially paints or Appaloosas, would be something called squamous cell carcinoma. So it can look like a sunburn, but it actually is a skin tumor. And this can be diagnosed with your vet using a biopsy and then certain characteristics of the appearance of it. Other locations for skin cancer to be aware of would include the sheath and penis area, or the vulva, or around the rectum. And so these are all really common sites for squamous cell carcinoma to hit, and they can be a site for other skin cancers. Another disease that looks like sunburn is vesicular stomatitis. This was a horse that I thought was sunburned, and then opening its mouth had ulcers all throughout the mouth, and then vesicles were identified too. And so this is important. Anything that looks even more swollen or more complicated, or if you have any concerns, contact your veterinarian and work through all of the signs and try to figure out what's going on with the horse. This is another picture of the horse, and just around the muzzle itself, it has that burned appearance. And again, just the same horse in a different picture, but very similar looking to sunburn. So don't be fooled on some of these cases, because something more severe can be going on. Another thing that can look like burns or sunburns would be summer sores. Another name for this you may be familiar with is habronema, and it's actually a really strange response to a parasite larva that causes this massive inflammation within the skin. And so that's another thing we don't see very commonly in Colorado, but if you're watching this from other states, this may be something that you struggle with. This is another picture of habronema, and it just, again, it just looks like a little burn, but it can cause a very severe problem for that horse. So working with your veterinarian, trying to sort through what some of these lesions are, can be really helpful. And then other diseases can look like burns or sunburns too. And so sometimes they can have infections that are internal that can cause secondary effects on the skin. And then other times their own immune system can become hyperreactive against their own skin cells and cause severe pain or severe itching. And so these are other things to consider when looking at a horse that's got skin lesions that may look similar to skin burns or sunburns. Another topic to touch on is the photosensitization. And so what this means is that the horse is responding very abnormally, and it's a reaction with the UV light exposure, and it only happens to non-pigmented regions. So a little bit similar to sunburns, only more profound response and more abnormal than a straightforward sunburn. And so some of the signs that you may see would be sloughing of the skin or skin loss. You can see increased redness in the area. It can be very painful to the touch. And you may have regional swelling associated with the skin that's affected. So this is a confusing process that requires some sort of triggering agent, and this agent has to be within the skin or on top of the skin, had some contact with the skin. And so the agent, it triggers the skin to become more sensitive to those UV rays. And so some of the examples of what these causes might be can be ingestion of or contact with an agent containing plant. Some of the topical ointments or sprays in very individual cases can cause lesions like this to occur. And then some of the medications can also, and drugs that we use, can very rarely, but can cause some reactions in the skin to affect only the non-pigmented areas. And then also liver disease can be a cause for triggering photosensitization. Some of the examples of plants that may cause this if ingested would be St. John's wort, if the horse eats enough of it or has contact with it. Another one is buckwheat. And then other possible plants, and it just depends on how much they're eating and maybe the genetics of the horse itself, but clover, alfalfa, whiteheads, and perennial ryegrass can all cause this condition. They don't all always cause this, but they can in some cases. And then liver disease, and its relationship with photosensitization is a little confusing too, so we'll break it down. So a normal liver, the horse is ingesting plants all the time, and what the liver does is as the plants break down and the products such as chlorophyll or whatever else is in the little plant can be processed by the horse's liver and then excreted by the liver into the bile. So what happens with an abnormal liver is that the plant products build up abnormally in the skin, and then this can trigger photosensitization. And this is only seen in about 25% of horses with liver dysfunction. So it is a rare thing to see, but it's something that that's really important to consider for a horse with photosensitization. This is a horse with photosensitization and liver disease, and so the things to note are the muzzle is affected. It's the same picture or the same horse that the picture previous was showing. And then the other thing to note is that the horse has recent weight loss, and so it's a pretty thin body condition, and so this was another sign that it had two things going on. To diagnose this, you should work with your veterinarian, and things that are really important to do would be a physical examination, blood work, sometimes a liver ultrasound, or even a skin biopsy. I didn't write this one down, but a skin biopsy of the affected skin itself. And then also we can do things like plant analysis, looking for toxic plants in your pasture areas or areas that you might ride and might have exposure to. And then also it's really important to review any recent medications, sprays, or shampoos that your horse may have had exposure to. So photosensitivity really depends, as far as treatment goes, on the cause of what's triggering it. And so as we try to figure out, and we work with you and the situation, we try to remove the source of the problem if it's possible and we're able to identify it. Sometimes corticosteroids are really helpful for treatment, and sometimes they're not effective. So it very much depends on the case. And then when it's secondary to liver disease, the prognosis is more guarded and is often more severe as far as the illness goes for that horse. So it's very important that we diagnose this and try to help treat as early as possible. Okay, so next I'm going to turn it over to Dr. Smith with Flybite Hypersensitivity.
Hi guys, thanks for having me here tonight and watching this. So I'm going to be talking to you about flybites. Let me get this PowerPoint pulled up. Oops, I think I'm at the end. All right, so flybite hypersensitivity. This is a very frustrating disease that we seem to find this time of year because that's when the flies are out. So a little bit about it. This is the most common allergic skin disease in horses. It is caused by an allergic reaction to the insect saliva. And there can also be a genetic component. We often find that horses in the same family line are similarly affected with sensitivity to flybites. Not every horse will react in the same way to flybites as we have in this disease. It's an allergy like you and I can experience, like hay fever or eczema symptoms. So it's something that not every horse is going to see, but when you do have a sensitivity, it's something that needs to be addressed. A common name for this disease is sweet itch. It's also referred to as Queensland itch and a dozen other things. The common bugs that we find causing these problems are in the list here. I think the most notorious bug is Culicoides, which is commonly referred to as a no-see-um. This is the one that we have the most evidence of the link that their horse is allergic to their saliva, but it's similar in the other flies here that I've mentioned too, that it's likely a local irritation as well as an allergic reaction to their saliva when they bite. The individual bugs don't vary a whole lot, and it doesn't really matter which one's causing the disease. However, it can be important to note that certain ones, like the no-see-um, tends to feed at dusk and dawn, versus most of the flies feed during the day. And as you know from personal experience, mosquitoes tend to hunt in the evening. So that can just give you an idea of when your horse is at the highest risk. Other things to note are things include that the Culicoides and the no-see-ums are attracted to standing water, manure, soiled bedding, and decaying straw and hay. Versus things like the hornfly really like to be where there are cattle nearby. So if you live near cows, maybe that one is bugging your horse more. And also some of them have different distribution in where they cause disease. But these are the bugs that tend to cause the worst problems. So what else do we see here? How do we know that we are dealing with a flybite hypersensitivity? First of all, the age at when you first see signs can give you a clue. Most of these horses don't start showing signs until they're almost 4 years old. So you might have a horse that never had a problem before, and now this summer they seem to be itchier or more annoyed by the flies than usual. There's also a few breeds we have that are more affected than others. You can see them listed here, including some of the ponies like Welsh and Shetland ponies, Icelandics, Shire horses, Arabians, Frisians, Connemara's, warm bloods, quarter horses. Those ones tend to be more affected. However, no breed is immune to this disease. And then another huge clue is that the signs usually come on in the spring when the flies come out and last throughout the summer and then tends to subside in the fall. If you live in the south or near the equator, you might see that the signs never go away because the flies are there all year long. And then finally, the distribution of the skin disease that you see in this. You can have a ventral disease, and that means the belly and the legs are more affected. And you can have a dorsal disease, so that means the back, maybe their mane and their tail are affected, where they're rubbing their tail or scratching their mane, and their face. So the clinical signs that we see here are what you might expect. Itchiness, I think, is the hallmark of this disease. You just see that your horse is itchy, rubbing on fences, rubbing with their tack, or even when they have a fly mask on, they're rubbing. They can also have urticaria, which is commonly known as hives, and those are the little welts that you'll see throughout the skin. Sometimes they're itchy, sometimes they don't really seem to be that itchy, but you can have that in this disease. And then just a dermatitis, and by that we mean inflammation in the skin. And with that you might see alopecia, which is hair loss, redness of the skin, or crusts and scabs, especially as they scratch that and open it up. In some cases the horses are so itchy that they scratch hard enough where they self-mutilate and actually open up sores and make things worse than if like a kid with chickenpox, you could ask them not to scratch. So with some of that, you might actually see a secondary skin infection where bacteria gets in there and makes it even worse. I have here some pictures of some horses affected by flybite hypersensitivity. These pictures are fairly extreme, but they illustrate the signs you might see better than more subtle lesions. So the picture of the face here you have is obviously an example of dorsal disease where the face is affected. You can see the ears. This horse has some alopecia, some rub marks below its eyes, and it's even rubbed up hair near its mane. And then the horse in the middle you can see has definitely rubbed its mane. It's probably the kind of horse that sticks its mane between the bars of a fence and just scratches until it rubs its mane almost completely out. In your bottom left, there's this horse that's showing hives. Hives you don't only see with flybite hypersensitivity, and you won't necessarily see it, but it's something to consider. And then the upper right, just a great example of a horse rubbing its tail. You can see sometimes that little frayed look to their tail. Even if you don't see them rubbing, that gives you a clue that maybe they have been. And then this one in the bottom right is a horse. This is a picture of a horse's stomach, so we're looking at them from underneath. And you can see this pretty extreme dermatitis on its stomach there caused by the flies. So those are the things to look for. diagnosis in this really isn't all that complicated. It pretty much boils down to the history that we get from you when we come to look at your horse, the clinical signs that fit the pictures I just showed you, and the response to treatment. We'll talk about treatment more in a bit. So there's a question about allergy testing that we come across occasionally, if that's what helps diagnose for Flybite hypersensitivity. It's not necessarily a bad idea, however, it is kind of complicated, and it's not as straightforward as we might hope. So allergy testing is really great to determine if your horse is allergic to environmental allergens, and those might include things like dust, mites, the bedding, certain plants in their diet or in their environment. And that's really helpful in diagnosing a different disease called atopic dermatitis, which affects dogs and people. But it's really often unnecessary for Flybite hypersensitivity, again, because it's usually pretty clear based on the clinical signs we're seeing and the fact that it's fly season, what we're dealing with. But also specifically for flybites, we found that allergy testing just is really difficult to interpret. So at this moment, it's really not the best diagnostic tool. However, for diseases, if you find that you're not responding to treatment for Flybite hypersensitivity, maybe it's something to look into after that. So treatment for these, we have several goals. The first one would be to reduce your exposure to flies for you and the horse, mostly the horse. Also to control their itch and stop that scratch-itch cycle. And then if necessary, to treat secondary infections. And that's really on a case-by-case basis based on if you need to include topical treatment, bandaging, antibiotics. So we won't go into depth there. And then the tools that we use to treat this are things like fly avoidance. I'll go into more detail on all of these. Antihistamines, steroids, dietary supplements, and then I'll touch briefly on hyposensitization. So reducing exposure. The one that I don't have on here is actually just your manure control program. So obviously, if you have less manure, you have less flies. Also reducing things like stagnant water, if you can be helpful. But depending on what you can or cannot do for the flies, there's things you can do to protect your horse. So the most basic would be fly repellent. You want to use something with a pyrethroid or a permethrin that's at least 2% concentration. You can try other remedies, herbal remedies, but unless you've tried the permethrin, I would say, and it's not working for you, I say you should do that before moving on. Also, you can just use protective coatings like fly masks, sheets, or even the leg coverings. Some horses that are affected on their legs just really need something more robust than fly repellent. Another thing to consider would be to just try to avoid the flies altogether by stabling your horse indoors. This is most important during those peak feeding times for the no-see-ums like sunrise and sunset. And another thing you can do when your horse is indoors is cover the windows. Regular mosquito netting doesn't work very well for the no-see-ums, so you have to make sure it's an ultrafine mesh screen. And obviously if you have doors open, it's not super effective unless you can completely shut it down, which isn't always great for their ventilation and that sort of thing. Another thing you can try is using heavy-duty fans, either ceiling fans or stall fans, because the no-see-ums are really poor flyers, so even just the fan can help keep them off. That's not as effective for the flies. So the next goal of our treatment is to control the itch. The first line of treatment that you can do is just topical therapy. So even cold water has really nice anti-pruritic or itch-stopping effect. You can also use things like dilute hypoallergenic shampoos, moisturizing shampoos, because a lot of times their skin gets dry and needs moisture. Some shampoos with colloidal oatmeal can be great, and some even come with hydrocortisone, which is a topical steroid. Again, you can also use triamcinolone, which is another steroid, in the form of a spray, just to apply directly to the affected areas and hopefully stop them from scratching, especially if they start self-mutilating. The next line of treatment we have are antihistamines. So these work similarly as they do in people. So our first line one of the very effective antihistamines in this disease is hydroxyzine, and it's often one of the first things we reach for off the shelf when we're treating. There's a few other antihistamines that we can use, and horses have different responses to these, so just because one antihistamine doesn't work doesn't mean they won't respond to another. So diphenhydramine is another common one, or Benadryl, and then there's a drug called cetirizine, which is commonly known as Zyrtec, again a human medicine, that can also be tried. And then a lot of these treatments, both the topical treatments and the antihistamines, work best when you combine them with other treatments. Again, controlling their exposure to flies is really important, but sometimes we have to reach for more medication if this doesn't work. And the antihistamines are usually given orally, 2, sometimes 3 times a day. So that's something to consider. It's a bit of an investment in your time. But they are fairly low in side effects. The most common thing you see, which is rare, would be lethargy or maybe some behavioral changes, which is something to discuss with your veterinarian if you're seeing that. But overall, they're pretty safe drugs. So the next thing to reach for if antihistamines and your other control methods aren't working is systemic steroids. So these drugs that we reach for are commonly prednisolone and dexamethasone. And prednisolone is fairly safe to use in long-term treatment, but it's not always enough. So sometimes you need to add dexamethasone, especially at the beginning of your treatment if you're not getting the control you need with prednisolone. However, it's not the most safe drug to use long-term in really any species, but horses specifically. And you need to be especially cautious if you have an overweight horse that's not as good at, well, they have a predisposition for laminitis when they're overweight, and steroids also may cause laminitis. So you need to be extremely cautious if you're using this, and definitely discuss it carefully with your veterinarian before pursuing this treatment. But certainly the steroids are the most potent drugs we have to combat this, and a lot of horses really can't break the cycle without at least a short course of steroids. So other things you can try after these medicines that I've already talked about would be dietary supplements. And again, this is not something that's going to work on its own, but it's something to add to your treatment if you just want to do something more for your horse. So something you can do that's really good for more than just their allergies, but also their skin and their just overall inflammatory level would be to add some omega-6 or omega-3 fatty acid supplements. The higher the omega-3, the better. And these are found in things like flaxseed oil and fish oil, which is generally well tolerated by your horse. There's also some commercially available allergy supplements that you can look up. And these certainly won't have any negative effect on your horse, but there's not as much research behind them because they are supplements instead of medication. But you can certainly try one and see if your horse responds, and I'm sure they wouldn't mind it. And the last thing I'll talk about for treatment is the idea of hyposensitization. You see this in humans with allergies. It's where you take a little bit of the thing that they're allergic to and you inject it under their skin in increasing doses as you go along. And what this does is it basically desensitizes your immune system to the allergen. And it has been shown to be effective in certain cases in horses. However, at this point in our research, we haven't seen that haven't proved that it's effective for flybite. And again, it's a complicated thing to research, and it does require that we have done the allergy testing to figure out exactly what they're reacting to, like which fly, which insect, if it is their saliva. And like I said before, that's not been shown to be very straightforward in flybites so far, so therefore we haven't been able to really develop that for the treatment either. But hopefully this is something we might hear about more in the future as more research is done. As a quick summary, Flybite hypersensitivity is the most common allergic skin disease in horses. They are allergic to the saliva from the biting insects. You tend to see it in the summer, especially in places that cool off during the winter where the flies die. The signs you see are itchiness, hair loss, redness and scabs on the skin, and possibly hives. The diagnosis is really easily achieved based on your history and clinical signs, and the treatment would be with fly protection, antihistamines, steroids, and potentially the dietary supplements. So that's all I have for you guys. I'll turn it back over to Dr. Swain.
Thank you, Dr. Smith. Okay, Dr. Bass, we're going to have you talk about sarcoids, please.
Sounds great. Thanks so much for good stuff. So the last of the three topics we'll talk about is sarcoids. And they happen to be the most common type of skin tumor that we see in the horse. The more frustrating component to this is we just really aren't sure of the exact cause, but we do have some ideas that it's related to maybe a bovine papillomavirus. in cattle. So, some of these can be small in size. Some of these really have no disruption in the horse's lives. And then some of them are huge or in really interesting spots, which cause things to happen quite quickly. The problem that we have is some of these can just start spontaneously growing and lead to a real health concern and a health problem for your horse. And then the other thing that we have learned is some of these can occur at the site of an injury. So for example, you have a wound on your horse's leg or face, you can actually get a sarcoid developed there. So, which leads us to maybe some sort of viral cause, but again, the word is still out on the exact etiology or really cause of this disease. So we're going to go over a couple of different types, or 6 types of the sarcoids, and we'll talk about how to diagnose them and treat them as well. The first is the occults, which, as you can see in the picture on the bottom right, is really a circular hairless area or altered hair quality. It does happen on the skin. It can cause the skin to be slightly thickened and lacking normal elasticity. These are found commonly on the face, the withers, and the thigh areas. And more importantly, a biopsy can actually lead to this getting worse. So you can see how big this area is on the horse's neck, and that's one of the things we'll talk about is how to diagnose them, but just realize biopsying some of these can actually make them worse. The second type is these gray, scaly, wart-like appearance ones, and you can see they're obviously different from the first kind. They basically cause the skin to have flakiness and scaling if easily rubbed. They are well-defined circular areas or cover large surface areas. And again, these are found, as you can see on the pictures, commonly on the face, the groin, the sheath, and the axillary region, which is in between the front 2 legs, kind of where the girth may go. The third type, and these can be really problematic just due to their size and location, are the nodular form. These are discrete nodules under the skin. Unfortunately, some of these can ulcerate and bleed, which can cause an unsightly place on your horse. They have been described to be in the shape of like a bunch of grapes appearance. These can be found on the eyelid, the groin, and again in between the elbows. The eyelid nodules can be deep and have extensive roots, which makes them extremely difficult to treat. And again, interference with these can cause them to become much worse. So as you can see on the picture on the bottom left, this is a terrible area on the horse to have a sarcoid because it's extremely hard to treat and get that eyelid functioning back again. Fibroblastic, these are more fleshy masses that will really bleed when they're manipulated or touched. They can be wet and have a hemorrhagic surface. You can see one on the bottom of the sheath of this horse near around the penis. Common in really the previous sites that we talked about, and around skin injuries of the limbs as well, which can make for a really tough situation. Now, one of the last types is what's called malignant, and that word really has a negative connotation, but in this situation they do spread, but they just spread to local areas. So these are extensive, local, or wider spread throughout the skin and the subcute. Really on these, the size is not what's important, it's the extension underneath the skin that is. The biggest point to make on this is does not spread to internal organs, so you're not going to get these spreading to the liver, to the lungs, to the kidneys. But these can really be problematic, as you can see on the back end of the horse, as far as trying to remove all of those. They're quite difficult. And the literature has said basically these can be a possible consequence of unsuccessful treatment attempts from other types of sarcoids. So as you can see, these things can kind of grow and mold into different kinds. The last type is what's called mixed. So this is a mixture of 2 or more types. Not one type is really dominant. There's just a complete mixture of these. Again, the head, the axillary region, and the groin are quite common, and they do have a common diagnosis. Just really unfortunate that this horse has to have them around the eye and the ear. Just a real hard thing for us to treat in this fashion. So diagnosis, as you can imagine, I've been talking about biopsy. This really gives us a definitive diagnosis. There are other things that can cause a similar appearance, like proud flesh, like squamous cell carcinoma. And so we really try to diagnose these as best we can to help us treat them and treat them as successful as we can do that. Some lesions, some sarcoids are really, it's contraindicated to biopsy them. They can get more aggressive, following the interference. So we like to take the entire thing off, which is called an excisional biopsy. That allows us to make sure we got all of the margins. So it allows us to submit it to a lab and for them to say, yes, all of the margins were clean, or no, some was still left behind. So it really gives us an idea of prognosis moving forward. So as anything in veterinary medicine is concerned, treating it as early as possible gives us the best chance to get your horse basically, at the highest percentage of recovery rate. However, prognosis for these guys are in the 50 to 60% range, and it's really hard to get them to 100% cure rate, and that is really dependent on when we see them, and location has a lot to do with it as well. We'll talk about some treatments next, but the best possible treatment is applies the first time. Once we go back a second and third time, it really makes it difficult to get that high percentage of success. So what happens if your vet says just leave it alone? I think you may hear that from these small sarcoids that aren't growing, that don't do anything, that are just hanging out. I like to check them on an annual or a biannual basis, and if they're not causing a problem for anything, then sometimes we just leave them alone. But that's really dependent on what your veterinarian and you thinks, and the site of the sarcoid. So how's the best way to remove these? As you can see, this is probably the inner thigh of a horse, and surgical removal is quite fun to do, but it gives us really a high success rate. It reduces the tumor volume, and it improves killing efficiency of other treatment modalities. So I think that's the first thing we go to if there is extra skin to be able to remove and close underneath, is try to surgically remove them, and then kind of treat them with other modalities that may last a bit longer, if you will. More recently, the laser removal has become quite popular. Basically what happens is you take a laser energy, it's absorbed by the surrounding tissues. It does kill the tissues just beyond the wound margins. So as we go back to that biopsy, it helps us get better margins. However, it can aerosolize infectious particles and agents from the sarcoid being removed. So I think this is a great option. Again, it really depends on the location and the size and what type, but I think this is something that referral hospitals, universities has in their toolbox, and so that's something that your local veterinarian would definitely refer to a surgical facility. One thing that most every practitioner, every veterinarian has access to is cryotherapy, and that is basically taking liquid nitrogen, that semen is frozen in, that's used for a lot of different medical purposes, and you put it in a handheld device, as you can see on the picture, and you're able to do a freeze thaw on the tumor. It can result in scarring and hair pigmentation changes, so you may have a bay horse that has a couple white spots on it. But I think this is a very easy, effective, cost-effective way of treating these guys. You do have significant tissue destruction, around the tumor, so it may not be the best thing to use around the eye where there's such sensitive tissue. Cisplatin is our chemotherapy that we use for sarcoids. There's two different forms. One is the injectable form, which is basically in a needle and syringe, and the second comes in more of a long-acting bead that can be placed around the edge of the sarcoid. The studies that have been out there have a super high success rate with cisplatin if done over 3 to 4 to 5 injections. So something that's done once or twice. Once a week or twice a month, for 3 to 5 injections. It is an investment. It does cost more, but as things do cost more, they work better. Large sarcoids are usually treated with cisplatin after they are debulked with surgery, so after they're removed. And the biggest downfall of using this is it's a chemotherapeutic drug, and so we have to use gowns and gloves and eye protection, and you have to kind of do the same around the horse because it can cause some issues, if you get it on your skin or ingest it. So it's something not to take lightly, but it's something that can really help our success rate. Another medication that is actually manufactured here in Fort Collins is called Xterra. It's a bloodroot extract, and it basically stimulates the immune system to cause the sarcoids to slough within, say, 7 to 10 days. This can be helpful. However, it can cause a significant amount of skin irritation and can really cause some unpleasant behavior in the horse. So I think case selection is extremely important. Finding the right case, finding the right sarcoid. I just went to use this last week on an ear, and it says on the bottle, do not use on ear, as it can make a hole through it. So I think it's a good option. I think it has to be, the case has to be selected correctly, and your veterinarian has to, examine the horse and then kind of recommend it from there. There are a lot of other immune stimulators, a lot of herbal treatments that people are using for sarcoids. However, we just don't have a lot of research that shows those have a high success rate. So you may run into other things that people are using or hear about more things coming up. I will tell you that CSU is starting an equine sarcoid vaccine project. So if you're if you're close to Fort Collins, if you're in the Front Range and have that kind of on your mind, kind of just be talking to your veterinarian about it. It's going to be contacting CSU from your veterinarian, getting some information about it. We'll have information about it coming up, but this is some new exciting stuff that may be coming out. So for success of these guys, early recognition and appropriate treatment is always great for a successful outcome. Treatment selection, as we've talked about, really depends on the location of the tumor, how aggressive is it, the clinical experience of the veterinarian, client compliance, how much are you willing to invest into this. The patient behavior can be a huge thing if we're having to treat it multiple times. And really the availability of services, facilities, and equipment can really drive what you may do for your horse with these sarcoids. So that concludes my portion. I think I'll swing it back over to Dr. Swain for some questions and answer, and we'll go from there.
Okay, thank you guys. All right, so we've got a few questions already submitted, and just remember that you can continue submitting just by commenting below or using that hashtag paging Dr. Ram and on any of the social media avenues. So the first question is for Dr. Bass, and Judy emailed us earlier today, and she was curious as to why sarcoids seem to affect horses more in summer and why they seem to grow in ears more, which is more of a fly-prone zone. Can you comment?
Yeah, it's a great question. I agree. I think we do see more issues with sarcoids in the summertime. As I had mentioned earlier, it can be due to a bovine papillomavirus. So how does it get from the cow to the horse? I think we have to look at flies. We have to look at the same vectors that Dr. Smith was talking about for the Flybite Hypersensitivity as being those ways of getting it from one to the other. I think flies love ears. They go into ears. They have long hair in there. I think they really kind of set up there. So I see a lot of sarcoids in ears. I see a lot of them around the face, the eye, the muzzle, and all of those are fly-prone areas. Why the flies like those areas? I think they're just nice feeding grounds, but it really makes those areas are really difficult to treat. And so I think having a fly mask with the ear protectors is something I didn't mention earlier, but always is a great way to sort of decrease the incidence or the incidence of disease, basically, is what we're talking about. So yeah.
Okay, thank you. Okay, next question. This is for you, Dr. Smith. This is from Lisa on Google+. Our horses have skin issues starting every spring. It looks like hard yellow gold serum that shows up on their chests, but also their faces, stomach, haunches. We have been told this is due to bug bites, but it shows up in the winter as well when there are no bugs. It started with one horse, and now others in our herd have it. No one has been able to tell us what it is or how to cure it. Also, some of the herd has striated horizontal lines across their chests that are very itchy. Nothing seems to cure it, just to mitigate it. We have used SWAT and fungicide. Do you have comments, Dr. Smith?
Wow, yeah. Hi, Lisa. Sounds like you have a complicated question there, and I don't know if I can give you the answer as far as what it is, but maybe I can come up with a few ideas for you. The fact that you're seeing these signs coming on in the spring does seem like it could fit with something to do with insects. The yellow crusty granules might be serum from that comes from the blood. So when you have inflamed tissues, sometimes serum can leak out, and it might be like a yellow or amber color. And going back to Dr. Swain's presentation where she mentioned summer sores, those actually have something called sulfur granules that are similar in appearance to what you're describing. But usually, like the picture she showed, they have a bit of a wound associated with that and some inflammation. So I'm not sure if that's what's going on with your horse. And the fact that it continues in the wintertime is also a little confusing. If it were an insect caused by insects alone, you would think that that would decrease in the wintertime. So they might be allergic to something else that's causing inflammation in the signs of itchiness that you're describing and the yellow crystals that you see. And the vertical or the horizontal striations in the chest might be a description of hives, the urticaria. The picture that I showed in my presentation were little round spots, but they're actually, horses can get linear hives. You can Google that if you want to see if the pictures match what you're seeing. And again, that's another sign of inflammation. So if the SWAT hasn't worked, which is kind of a local treatment, and fungicide, again, topically hasn't worked, then you can certainly try any of the treatments that I mentioned in my presentation, just trying to decrease their exposure to flies. You could try some antihistamines like hydroxyzine that you discuss with your veterinarian, which one might be best, to see if that helps their inflammation cycle. And from there, potentially even steroids if that's not working. Another thing I might suggest is if they're allergic to something in their environment, like their bedding, or maybe something that's set up in their tack, like saddle blankets, breast collars, overnight blankets, something like that, you might just try laundering all those things really well to hopefully get anything that's irritating them out of it, maybe even replacing some of those things and see if that helps. And then you can also try some of the topical things like shampoos, topical hydrocortisone, and see if that helps, even just cold water. So again, I'm sorry I can't diagnose you and your problem, Lisa, but hopefully some of those things might help.
Thank you, Dr. Smith. And then one other thing I have to add about laundering, I have had a couple horses that sometimes detergents themselves that we wash our own clothes with can be irritating to the skin. So just run an extra rinse cycle if you're using a detergent to treat any of your tack or anything like that, saddle pads and that type of thing. So just one other comment. And then I've got a question for me. The question was, since photosensitivity and vesicular stomatitis look alike, how do I know the difference? The biggest thing, because they can be very confusing to look at, the biggest thing is that sunburns or photosensitivity, it shouldn't affect the pigmented areas in theory. And then another component would be the horse should not be lethargic at all or depressed. It should eat really well, and in theory, it should they shouldn't be drooling or anything like that. Vesicular stomatitis often causes ulcers within the gums and on the tongue of horses, or even around the coronary band or in the ears. And so any of those areas affected, I would have vesicular stomatitis higher on my list, and I would definitely contact your veterinarian and try to sort through it that way. And then I've got another question. This is from Deb. She emailed us, and then she said she wanted to ask about scratches, the fungal bacterial kind. She says, I don't think this is particularly a summer issue, but I'm dealing with it right now. Specifically, I would be interested in any treatment advice. I have received a lot of contradictory information so far, and possible prevention tactics. So this is a tough topic, and just want to say that I'm sorry, Deb, that you're dealing with this. So it really depends on the horse and what the exact cause is. There are a lot of different causes, as you kind of already suggested, between fungal and bacterial. And so the treatment has to depend on how it looks with your horse and what regions it's affecting. Scratches normally affect the limbs and the legs of horses, and is most common in the hind legs. And draft horses are the problem child, the poster child for scratches, but it can affect any breed. And so definitely recommend working with your veterinarian and trying to go through some different options, whether it's environmental management and trying to help the horse find a dry environment to reduce the moisture content that it's exposed to. And then some degree of bandaging sometimes helps these horses, depending on what's driving it. And then also some of the treatments we use are topical. Sometimes we also incorporate steroids into it in order to, like, topically, or in conjunction with the antimicrobial use, and sometimes that helps the profound inflammatory response that the horse has. And then sometimes the cases are really complicated and require even systemic antibiotics or something like that. And so, and then there's this other condition that draft horses can get that's even more severe but can look like scratches. So definitely recommend working with a veterinarian you trust and trying to take it one step at a time, because each case is very different, and certain things can be very helpful or not helpful at all in your horse. So best of luck. I am sorry, I've struggled with scratches many times. Okay, so I think we are good. We will continue looking for emails and questions and try to respond to those as quickly as we can in the next day. And then feel free to rewatch the presentation. It will be available on the CSU College of Veterinary Medicine and Biomedical Sciences YouTube page, or also on the CSU Vet School Facebook page. And then we really thank everyone for joining us tonight. And any questions, remember, you can comment below or submit through social media using that hashtag paging Dr. Ram. Thank you all for joining us, and thank you, Dr. Smith and Dr. Bass, and have a good night. All right, take care.